So it was a big day for you yesterday, right? You got the vaccine, as I understand it, a decision you made only hours before getting the injection. So what made you decide finally to get that first dose?
Well, I had coronavirus. I've been checking. I have long-term antibodies, checking with my doc. And I had decided that I was going to check every 4 weeks. And as long as I still had antibodies, I wasn't going to get the vaccine. Some of that was probably my own fear, quite honest. Some of it was I wanted a dose to be for someone else. But as I started sharing that, I just kept hearing, Dr. Stanford's not getting it, I'm not taking it. And I realized that my plan for my individual plan wasn't something that everyone else could do, that they had access to get their blood drawn every 4 weeks, that they could, text their doctor and say, here's my plan, and now I'm ready for a vaccine. And so that was good for perhaps me individually, but not for everyone else. And I wanted to lead by example and show that I trust the science, that I believe it's safe and efficacious. And so that's where the decision came in.
So it's been a little more than 24 hours, right, since you got the vaccine. So how are you feeling, and what are you expecting?
Yeah, I mean, I feel pretty good. After the shot, my arm was sore. It typically is after a flu shot, but definitely sore. By this morning, it wasn't, and it, feels pretty good. I can move it. I felt a little queasy to my stomach yesterday, but that also passed. And today, I feel like myself. It was a snow day, so I just kind of hung out around the house most of the day, but I feel good. I don't feel any different. No fever, no increased tiredness or anything like that.
That's great. Good to hear. So what do you say to anyone out there still debating whether to get the vaccine?
So it's definitely an individual choice, but independent observers from all over, and particularly in our region that I trust, have looked at the data, they've weighed it, and you have to weigh, is it more risky for you to get coronavirus, or is it more risky for you to take the vaccine? And as you know, with coronavirus, you could be asymptomatic, you could have a moderate illness, you could end up in the ICU, or you could die. And to me, that is much more risky than a vaccine that the immediate and intermediate side effects of. It's not just about you. It's not just about you. And it's how we decrease the transmissibility. It's how we get closer to that 70% herd immunity number, where the level of disease is so low in the population that we can get to containment and really stop these record numbers of death and disease every day in our country. I would encourage people, have conversations with your doctors, speak to healthcare professionals. I'm certainly as available as I can be through our website to get those questions answered and maybe some of the fears alleviated.
Dr. Ayla Stanford, thanks for joining us tonight. We're glad you're doing well after getting the vaccine yesterday.
Yes. Thank you, Jim.